Доброго дня.
Good morning. We start our working day in Ukraine Crisis Media Center. We will be talking at our briefing about European Immunization Week in Ukraine. You see that this week we have banners in our premises which say why it is so important to be immunized. And now our speakers are Ulana, Suprun, Acting Minister of Health of Ukraine, Vashchuk, Ambassador Extraordinary and Plenipotentiary of Canada and Ukraine, Giovanna, Barberis, Head of UNICEF Office to Ukraine, Pennell, Deputy Mission Director at USAID Regional Mission for Ukraine, Moldova, Belarus and Cyprus. Good morning. Thank you. Vaccination is the matter of national security of Ukraine. This is the most successful and most economically efficient strategy to prevent 28 heavy diseases. The developed countries they have more vaccines included into medical aid. In Ukrainian schedule, you can see it in my hands, we have only 10 vaccinations against 10 infections. In Western Europe, in America, 13 more diseases are included into the immunization schedule. We need to add more infections to be immunized against. We have cases in Ukraine. We have cases both of tetanus and measles and 2-year-old boy died because of TB. We have also an outbreak of polio in 2015 in Ukraine. Since that time, we started working with our friends from international organizations such as UNICEF, WHO, USAID, our partners from Diplomatic Corps, Canada, USA, France. They have helped Ukraine to increase vaccination coverage of our children. Vaccines, they save lives, and our children's health is compromised. It is threatened by infections. So vaccines can save lives, and we have unfortunately awareness campaigns in media against vaccines. They repeat unproved facts. They threaten children's lives due to such campaigns. Doctors provide public awareness. Contraindications, yes, they sometimes are available. Parents who reject vaccination without any contraindications, when doctors they try to persuade them to keep to good sense, but they proceed to reject vaccination, they pose the health of their children under threat. We should protect our children against infections which cannot be present in this century in the world. Trainings for doctors and nurses are conducted in Ukraine so that they know how to communicate, how to inform the patients. There were good pieces of advice from our trainers. When there was an outbreak of polio, UNICEF provided us comics telling about vaccination, telling why immunization is needed. And now we will listen to Mr. Vashchuk how these programs work in Canada. We will develop such communication. It is very successful when children get public awareness sessions so that they understand that they should be immunized and request their parents whether they have been immunized. More than 90% of children should be immunized, and every year we purchase more and more doses of vaccines, bringing them to peripheral regions via UNICEF so that they're available in the regions where they are most needed. When parents go to doctors and doctors say that there are no free of charge vaccines and there are no vaccines against those infections which you want to be immunized against, then please go to health authorities, regional health authorities, because we have very many doses in the region. If they do not respond, please address us, address the ministry. The request for vaccines we can't save $17 million in 2016 and even more in 2017. We should be progressive agents of changes, and as media persons, as representatives of NGOs, we as representatives of medical community should be those persons, those individuals who change our system, change our society. And our step is to strengthen immunization programs. We as a ministry will proceed bringing high quality vaccines to Ukraine. Health care staff will be trained. We will provide trainings for them, and we will change protocols so that they can disperse these vaccines and administer them, and so that they are not afraid that they will be accused of using vaccines when some counter-indications are in place. They should be protected. How they will immunize the children they are responsible for. The main thing is to protect our children. Children are future of our country. Without protecting them, our country can't develop as a civilized European country. And finally, I would like to tell you about the programs of public awareness of immunization. There are many myths which are present in our society. I would like to tell you about them so that you understand how mass media can help us to disseminate true facts. There is a myth that it is better to experience the disease and this way to develop an immunity. We know that there are many disabled persons, even in a presidential administration. There is an individual who is disabled from childhood because he suffered polio while a child, and he was not immunized because the USSR didn't support immunization programs those days. We should be ready, we should have immunity before disease may start. Vaccine can overload the immune system. No, this is wrong, because after the administration of vaccine, some effects may develop, but this is normal. We just want to strengthen immune system. Counting the side effects are worse than the disease. This is not true. Who want to suffer polio or to suffer pertussis or measles? We saw cases of tetanus in Ukraine, and children were in resuscitation room for weeks. 1 or 2 days of fever is far easier to experience than weeks of resuscitation room. These diseases are not available in Ukraine. This is not true. They are not present in the world. Vaccination against smallpox is not administered in other countries because the smallpox has been eradicated in other countries in the world. This is because the immunization sessions were in place in time. The disease was really fatal, but now it has been already eradicated. I call on you to protect our children. They are our future, and we are responsible, both the ministry, the NGOs, the international institutions, the doctors, the nurses, and the parents. All of us are responsible, and we will fulfill our obligations to supply doses in time, to provide training to our doctors and nurses. And you as mass media persons, please write the truth, disseminate the truth in newspapers. Thank you very much, Ms. Suprun. What else Ukraine can take from Canada experience, from Canada lessons learned? First of all, although the scales differ, the challenge is the same for all countries. No country is covered 100% by vaccination. In Canada, 91% coverage is demonstrated. That is why the federal government of Canada launched campaign to reach the public which has not been reached yet. This is because of some cultural specifics. And within 5 years, we will spend 25 million Canadian dollars to outreach, to increase our outreach to 95% of immunized children. We use different methods which can build trust, confidence of parents in the system of healthcare of Canada. So parents have choice either to read some not scientific fears from newspaper or to read our scientifically well-grounded information about the vaccines which are used in Canada. They are the same which are used in Ukraine. So simplifying the access to reliable information for general public, we build the trust which we have in Canada. The rates of trust is high in Canada, but in Ukraine, as you can see from infographics, the trust in vaccination process has increased already thanks to WHO and UNICEF public awareness campaign. So we Canadians are glad that this support was provided to polio campaign, and the impetus was provided to mass vaccination to resume in Ukraine. And now I'm very glad that the ministry has already taken in its hands this process and control it, and the funds are allocated. I am optimistic, and I think together with time we will have more than 90% coverage both in Canada and Ukraine. Ms. Giovanna, Ms. Suprun has already told us about additional rounds of vaccination against polio. All of us remember that there was an outbreak in Zakarpattia region registered in Ukraine. Then UNICEF helped those days. There were meetings with doctors and other caregivers, and you had talks with media, with doctors, and explaining why it is so important to conduct immunization campaigns. Nothing can replace this talks with doctors. No campaign in mass media may replace these talks which you conduct, these dialogues which you maintain, so on which we should focus in immunization.
It is really great to be here today on the occasion of the European Immunization Week. It is great to continue, working on the advocacy on our advocacy efforts, and to really reiterate how important it is to improve the low immunization coverage in Ukraine, which is unfortunately one of the lowest in the world, and to really remind all of us that all children do have the right to be protected, to survive, and to thrive safe from deadly diseases. Now, we are trying all the time, to understand better why there are so many barriers against immunization, and indeed, as it was already mentioned, the shortage of vaccines was one of the main, barrier until recently. But in reality, today the situation has improved considerably. We have availability of vaccines throughout, the regions, so it's not really, an issue any longer. But unfortunately, we still have parents and medical workers that are opposing, this life-saving practice. Overall, there has been a positive trend in increasing support towards vaccination, especially, among families, as currently over 74% of parents support immunization in general. And this is an amazing result, considering, the departing percentage. However, around 13% of parents are still very much against immunization, and Kiev City, believe it or not, is leading, this group with 18% of parents opposing immunization. We also know that around 60% of mothers feel extremely anxious before they vaccinate, they vaccinate or they go for any vaccination activity with their children. However, medical workers are the most trusted and influential source for parents. 80% of mothers trust their doctors, and most parents take final decision based on doctors' advice. During the polio vaccination campaigns in 2016, we had estimated that around 16% of doctors were advising against vaccination. So there is some work to do. We believe this is one the major bottleneck in ensuring that all children in Ukraine are timely vaccinated according to the calendar. So we are really calling to all parents, families, partners, medical workers, civil society to use and to refer to only evidence-based information about vaccines. Misinformation can be really very, very dangerous. Again, there has been progress. There are still, challenges ahead. There is still quite a lot of work ahead of us, but we are really confident that based on this excellent partnership, international community, government, civil society, we will definitely manage to achieve universal routine immunization for all children in Ukraine. Thank you.
Дякую, пані Giovanna. Ви правильно сказали, не було б результату, якби не...
I agree with you that there won't be any positive shift without real synergy between the government and civil society in Ukraine.
Everyone, thanks for having me here at this immunization event this week. I'm very pleased to be here with the Acting Minister of Health, Suprun, also the Canadian Ambassador. Canada has been a good partner for the US and Ukraine on this issue, and of course our partners at UNICEF as well. Today we have an opportunity to focus on what actions must happen to mitigate the risk of further outbreaks of polio or other vaccine-preventable diseases in Ukraine. Most countries in the world, even those less developed in Ukraine, have better immunization coverage. You've already heard a little bit about some of the statistics. I'd like to add just a little bit more. In 2015, the more than 12 million children not immunized live in only 10 countries worldwide. Ukraine is one of those 10. Immunization is among the safest and most effective public health interventions. Vaccinations can actually save millions of lives each year. Contrary to some of the myths that we have heard, almost all children can safely be vaccinated with approved vaccines. Unnecessary deaths and illnesses can be avoided with better immunization coverage. Today, the situation in Ukraine has improved slightly. By providing international procurement and through extensive communication campaigns and health worker training, we collectively have made progress in increasing immunization rates across Ukraine. But these positive developments will only have the desired impact if we have strong and visible political support from leadership at all levels of the Ukrainian government, from the national level to the rayon level, and from the medical community. Through the efforts of the Acting Minister of Health, Suprun, and other colleagues here, a foundation is in place to move forward with substantial health reforms. Again, these reforms are needed to overhaul the current system and establish an effective, multi-year national immunization program. UNICEF, which currently conducts international procurements for vaccines for Ukraine, has helped produce significant savings this year to use for additional vaccinations. However, procuring vaccines in this manner is neither sufficient nor sustainable. The government must commit to sustained public funding of vaccines and a national immunization program. We cannot risk the chance of a major vaccine-preventable disease outbreak. We must sustain the momentum of change. In closing, I would like to reaffirm U.S. government support for health reform at this critical juncture for Ukraine and urge our colleagues here in the government and the donor community to make it a priority. I wish you very much further success. Thank you.
Дякую дуже. Колеги, якщо у вас є запитання до наших спікерів, прошу.
Dear colleagues, if you have any questions, you have the opportunity to ask the question. No questions. Everything is clear. Ms. Ulana would like to add some information. My colleague from USAID have mentioned that we do not plan to stay in current situation. We wish to change our national healthcare system. We wish to shift to the governmental procurement of the vaccines, of important medicines. And currently we are creating thinking about creating Ukrainian agency dealing with procurement, but in the meanwhile, we have to deal with the requirements of World Health Organization and UNICEF. 100% of vaccines procured via UNICEF. These are vaccines pre-qualified by the International World Healthcare Organizations. That is, the production, the quality, the delivery of those vaccines is thoroughly controlled and monitored. I would like to assure all our parents that 100 vaccines which are procured via UNICEF were many times checked, double tested, checked in practice in many countries and in the laboratories. They are 100% safe. Probably our colleague Giovanna may mention those requirements which UNICEF put forward when they procure the vaccines.
Minister, indeed, the procurement of vaccines is a very, very thorough and very well monitored process. Is our supply division in Copenhagen that is in charge of procuring vaccines for hundreds of countries in the world, based on tenders and LTAs that they have and have been tested, throughout the years. We are only procuring vaccines and drugs that are pre-qualified by WHO, which means that these are products that have been going through, again, a very, very thorough quality assurance process, tested and absolutely safe. So I would like again to highlight that the whole process of procurement is, from the beginning to the end, is extremely well monitored. UNICEF also is not procuring vaccines, without approval and consultations, of course, with the Ministry of Health, and there is a very close, exchange on any product, any quantity, any technical detail with the Ministry of Health. Our office here in Kiev is facilitating, this process and liaising, with the Ministry, of course, here and our colleagues in Copenhagen. Thank you. Yes, now we know that there are always a lot of rumors, on how unsafe, certain vaccines are because they have been produced in, in countries that are not, non-European countries. For example, there is the whole issue of the Indian, produced vaccine, just to reassure, it's not a question of where, the vaccine is being produced, but by whom and how, and how well pre-qualified also the manufacturer has been, because the producer is also going through a very thorough quality check and quality test, and this is why it is some manufacturers are actually being pre-qualified, and the vaccines that they're producing are pre-qualified, just to trigger and to just to say that this is the safest, let's say, way of procuring and distributing worldwide.
Маємо запитання.
Доброго дня, мене звати Олена, телеканал.
Good afternoon, I'm Ulana, Inter TV channel. I have a question to Ms. Ulana. this is a tough question. We have Ukrainian citizens living in non-controlled territory. There are also kids and children there in non-controlled territories, and when these people come to mainland Ukraine, they become IDPs here, and we do not know how those children were vaccinated and how to protect those children. Thank you very much. This is the problem, not for even just IDPs coming from occupied territories. Even in some adjacent regions to the contact line, and even in Kharkiv, Kiev, Zaporizhia Oblast, not all the children are covered by vaccination. Whether who are IDPs and registered IDPs, they are not covered with vaccines. How we should cover them with vaccination if we cannot prove that they were immunized staying in the non-controlled territories? Probably we cannot prove whether there was any immunization and how it worked. Probably we have to carry out some tests to understand whether they are immunized, and then to repeat vaccination. We need to provide these children with immunity boosters, otherwise there might be a threat to these children. And also those children who will go to Europe in line with the visa-free regime, they should be immunized also. We should prevent a situation when they will be able just to buy a certificate about vaccination, and parents should not ask medical workers to produce such certificates about vaccination, and medical workers should request such medical vaccination certificates from parents, and convince parents to vaccinate children. I would like to add, I would like to continue the question, those children about whom we are not sure whether this is dangerous and whether we should test them. Those children should present certificates with the number of, the code number of vaccines. We should check these documents if parents are unable to present such documents and recollect what happened. So we should repeat vaccination. Thank you, dear speakers. On the slides, I have information about doctored certificates, fake certificates about vaccination. I hope that each year this figure will approach to zero. The figure about fake vaccination certificates, and it will reflect the real picture, and the more and more parents will immunize their children. Thank you.
Thank you so much. Thanks. Yes. No, we have seen. We always come up with new programs. Thank you. It's nice to see you. Thanks for the support. Yeah, absolutely. Thanks for the plug.
Yes, we're going to keep pushing that plug as much as we can.